Healthy Living in the Four Corners is brought to you by Southwest Eye Consultants, specialized medical and surgical eye care. A red sore eye is nothing to blink about. In fact, it could be an indication of a serious infection, immune disorder, or even cancer. The condition is called uveitis, a form of inflammation of the middle layer of tissue in the eye wall called the uvea, and it's characterized by redness, soreness, light sensitivity, and blurry vision. It comes on suddenly, disappears, then reappears. If not treated, it could cause permanent blindness. But it's even more important to seek treatment from your eye doctor because it could be an indication of a serious, undetected illness.
The eye is often referred to as the canary in the mine shaft, meaning that it's often an early indicator of systemic disease. And it's very similar in its molecular structure. We call it an antigen. There's antigenic components of the eye which are similar to the joints or the bowel or elsewhere in the body. And so often when there's a quiet disease process happening that you're not quite aware of yet, your eye becomes inflamed. And you come in and see your eye doctor and there is an idiopathic or unexplained inflammation. It's kind of like your knee swelling. Why did your knee swell? We don't always know.
Of course, allergies can cause red, itchy eyes, but uveitis is often more severe. So how can you tell the difference between the two? Typically, allergies are seasonal, affect both eyes, and include sneezing, coughing, and respiratory distress. You should be concerned if the redness in your eye persists and it keeps returning sporadically. Because uveitis may be a symptom of systemic infection or inflammation, treatment can be complicated and may involve consultation with additional specialists.
We give you the first one for free. So if you have the first episode, we treat it with topical steroids. We try to suppress it the best we can. But if this becomes a recurrent process, then we begin to involve other consultants, rheumatology, vascular, hematology folks, your primary care physician and internist, dermatologist, a gastroenterologist, or others. One of my favorite clinicians would tell me, don't look at the eye first. Stop. Take a good history. Because about 95% of the time, you can actually determine what's happening with a good history long before you ever look at the eye.
Whatever you do, do not ignore the symptoms and seek treatment, especially if you have more than one episode. One patient sought treatment for her red sore eye, and Dr. Fenberg, after consultation with rheumatologists and other specialists, discovered that her uveitis was a result of an autoimmune disorder.
In this young lady's case, had she not been recognized as having this autoimmune condition, she would have lost hearing, eventual sight, and also significant mobility issues. She eventually was sent to Denver to a rheumatology specialist who put her on a high-dose anti-rheumatic drug, and her symptoms completely melted away.
If you'd like to know more about the causes and treatments for uveitis, visit swiconsultants.com. I'm Deborah Urota for Healthy Living in the Four Corners.